Perpetual pregnancy affects ideas of what women are and can be. The aim of Women's Plans Foundation is to bring contraception to women who don't have it, especially in areas of poverty around the world. When you think of it, there are women who have no way of deciding how many children they have, and the world population is going up. Each generation is the largest generation ever having children.
Contraception is absolutely vital. It's such a smart, essential investment for the world, because basically contraception allows women to determine if and when they want to have children and determine the spacing of those children. It saves lives, it saves children's lives, it saves mothers' lives. It's just got a huge impact. It's incredibly important.
We've grown from some very small programs to having some significant national impact on contraceptive prevalence.
There's a push towards being conscious of climate change, absolutely conscious of the need for people to have good education, conscious of the fact that people need decent work. At these moments, the foundation to being able to achieve those sustainable development goals is actually women's reproductive health.
Women's Plans advocates linking reproductive health, gender equity, community well-being and sustainability through provision of family planning. And family planning has been proved to have great immediate benefits.
We can just have a short Qantas ride to not very far away, just a few hours, and we end up in the Pacific. And we know that the unmet need for contraception in the Pacific is amongst the highest in the world. The lifetime risk is 1 in 25 compared to 1 in 9,000 here in Australia. And I will say that those numbers in Australia are actually mainly women with heart disease.
2.7 million babies will die in the first month of their life this year. If all births in developing countries were spaced at least 2 years apart, infant mortality would be reduced on average by about 25%.
So we know there's a high use of ineffective methods, there's limited range of effective methods. We've got to look at new methods, and there's high rates of discontinuation, there's weak distribution systems, lack of data collection and evaluation, and then there's the cultural and knowledge barriers. This is a microchip. It's actually linked to a reservoir of contraceptive hormones. It lasts for 16 years. So potentially, our 16-year-olds can be microchipped with this at the age of 16. They can keep it going, and then when they want a baby at 25, they turn it off, and then they turn it on again afterwards.
There's a sort of intuitive link between contraceptive prevalence and ecological footprint, the resources one consumes in their lifetime.
And that's why today we speak out clearly about family planning. For the human family, there is more need than ever for us to support overseas aid to ever more practical methods of contraceptives.